How do you determine a patient's decision-making capacity for consent? Imagine you're about to make a big choice about your health. How do doctors know if you're able to truly understand and decide what's best for you? That's what we're here to find out. Deciding if someone can give informed consent is a careful process. It all starts with checking for key abilities. First is understanding. Can the patient grasp the details about their condition, the treatment options, risks, benefits, and possible outcomes? Doctors often ask patients to explain these in their own words to see if they really get it. Next is appreciation. Does the patient recognize how this information applies to their own life? Do they see what might happen if they accept or refuse treatment? For example, do they understand that refusing a surgery could lead to worsening health? This step makes sure they see the real impact on their personal situation. The third ability is reasoning. Can the patient process the information logically? Are they able to compare risks and benefits, weigh their options, and come to a decision that matches their values? They should be able to explain why they prefer one choice over another. This shows they are thinking through their decision carefully. Finally, expressing a choice is essential. The patient must communicate their decision clearly and consistently. This decision should stay stable over time unless they can explain why they changed their mind. If they can do all four things, they are likely capable of giving informed consent. In practice, adults are presumed to have decision-making capacity unless there's evidence suggesting otherwise. Certain conditions like delirium, dementia, mental health issues, intoxication, or severe pain can impair this ability. When there's doubt, healthcare providers may use structured tools or consult specialists like psychiatrists to assess capacity thoroughly. The process involves making sure there are no communication barriers such as language issues or sensory impairments. Reversible causes of confusion, like medication effects or infections, are addressed first. Then, clinicians conduct interviews focused on understanding, appreciation, reasoning, and expression. Sometimes they use validated assessment tools to support their judgment. From an ethical point of view, this assessment balances respecting a patient's autonomy with the principles of doing good and avoiding harm. It ensures that decisions are truly made by the patient, based on their values and understanding, without undue influence. To sum up, determining decision-making capacity involves a step-by-step evaluation of whether the patient can understand relevant information, appreciate its significance, reason about their options, and clearly communicate their choice. This process helps uphold the core ethical principle of informed consent, making sure patients are active participants in their healthcare decisions.